Here's something that should stop you cold. Right now, at this very moment, your arteries could be 50, 60, even 70% blocked, and you would feel absolutely nothing. No chest pain, no shortness of breath, no arm tingling, no warning of any kind. You could walk out of a physical exam with a clean bill of health, shake your doctor's hand, feel completely fine, and still be carrying a cardiovascular catastrophe silently building inside your body. And I know how that sounds. It sounds frightening. But I'm not telling you this to scare you. I'm telling you this because the very thing that makes this dangerous, the silence of it, is also the opportunity. Because if your body is building this problem quietly, that means there is a window of time where you can do something about it, long before it ever becomes an emergency. This is not hypothetical. This is the documented reality for millions of people every single year. Atherosclerosis, the fatty plaque that gradually builds up inside your artery walls, is a nearly silent disease. It doesn't happen overnight. It progresses slowly, quietly, for years and even decades. And here is the part that catches so many families off guard. For too many people, the very first symptom they ever notice is a heart attack itself. No gentle warning, no build-up they could feel. Just a sudden devastating event that seemed to come out of nowhere. But here is what most people, and honestly, even many doctors rushing through a 10-minute appointment, do not stop to recognize. Your body is sending warning signals right now, signals that are quiet but real. The problem is, they do not look anything like chest pain. They show up in places you would never think to connect to your heart. And because of that, they get dismissed, ignored, or blamed on simply getting older. Today I'm going to show you 3 of those signals, 3 signs that can show up on your body right now that are directly connected to what is happening deep inside your arteries, and that most people completely overlook. Sign number 1 you can check in the next 30 seconds, with nothing more than a mirror. Sign number 2 points you toward a simple 15-minute test your doctor can run that tells you more about your heart attack risk than most standard blood panels ever will. And sign number 3 has the most powerful research backing of any cardiovascular warning sign in modern medicine, and it affects both men and women equally. So stay with me all the way to the end, because I've deliberately saved the most important and most overlooked sign for last. It's the one almost nobody talks about, and it could be the one that matters most to you. Let's begin. Before I say another word, I want you to do something with me. I want you to look at your earlobe right now. Not your ear, your earlobe, the soft, fleshy part at the very bottom. Run your finger along it and check yourself in a mirror or in your phone camera. Go ahead, I'll be right here. The first sign is one of the most fascinating and least known findings in all of modern cardiology. And the beauty of it is that you can check it for yourself in the next 30 seconds, without any equipment, without any cost, and without leaving your chair. So look closely at that earlobe. What you are looking for is a diagonal crease, a line that runs from the small bump near your ear canal, stretching diagonally across the earlobe at roughly a 45-degree angle. It's not the natural shape of your ear, and it's not a fold from sleeping. It's a distinct, settled crease in the flesh of the lobe itself. Take your time. Look at both sides. If you see that crease, what you are looking at has a name. It's called Frank's sign, named after the physician who first described it back in 1973. And this is not some fringe observation. It is backed by over 40 published studies spanning nearly 5 decades of research. Doctors have been quietly noticing this connection for a very long time. So let me explain the science, because once you understand why this happens, it makes complete sense. Your earlobe receives its blood supply from tiny end arteries. These are small, delicate vessels that have no backup supply, no alternate route for blood to reach them. When plaque begins to build up inside the artery walls throughout your body, these tiny earlobe vessels are among the very first to feel the effects. The tissue they feed gradually receives less and less blood. Over time, that tissue shrinks slightly, weakens and collapses inward. And that collapse creates the visible diagonal crease you can see on the surface of your earlobe. Think about what that means. Your earlobe is acting like a mirror, a small visible window into what is happening to the microscopic blood vessels throughout your entire body, including the small vessels that feed your heart muscle itself. The same process narrowing the vessels in your ear may be quietly narrowing the vessels that keep your heart alive. And the research bears this out. A meta-analysis published in the American Journal of Medicine found that people with a diagonal earlobe crease had a 30 to 60% higher probability of significant coronary artery blockages. That is not a small number. That is a meaningful, measurable connection between something on the outside of your body and something hidden deep within it. Now, I need to give you a critical and honest distinction here because I never want to overstate things. A crease alone does not diagnose heart disease. It is not a verdict. It can also be influenced by other factors like age, genetics, and body weight. So please don't panic if you see one. But here is the clinical rule that matters. If you have a diagonal earlobe crease, and you also have other cardiovascular risk factors, things like high blood pressure, high cholesterol, diabetes, a family history of heart disease, or you are simply over the age of 60, then that combination should absolutely lower your threshold for asking for a proper cardiac evaluation. The crease becomes one more reason to look deeper, and I want to pause on that point because it's worth sitting with. We tend to think of our health as something we can only know about through expensive scans and complicated lab work, but your body has always been communicating with you in its own quiet language. The earlobe crease is one of those messages. It's free to read, it's available to you this very second, and yet hardly anyone knows to look for it. That's exactly why I wanted to start here. So here's your action step for sign 1. Check both earlobes carefully. If you see the crease on one side or on both sides, don't ignore it and don't panic. Simply make a note and bring it up at your next doctor's visit. Ask specifically about a cardiovascular risk assessment. You'd be surprised how many doctors take that observation seriously. Now, sign number 2 is one that shows up somewhere completely different. It shows up in your legs. But what it reveals about your heart is one of the most powerful and well-established connections in all of cardiovascular medicine. Right now, millions of seniors are walking around with this exact sign. And because it doesn't feel anything like a heart problem, they never once connect the two. Here's what you absolutely need to know. Let me ask you a question. Have you ever noticed that your calves, your thighs, or even your backside start to ache or cramp when you walk? But then the pain disappears within a minute or two once you stop and rest. Maybe you've been blaming it on being out of shape. Maybe you've told yourself it's just part of getting older, or that it's your bad knees acting up again. That's what most people assume. But this very specific pattern, pain that comes on with walking and relief that comes with rest, is a classic and well-documented warning sign of something called peripheral artery disease. Here's what's actually happening inside your body. Peripheral artery disease occurs when the same fatty plaque that builds up in your coronary arteries also builds up in the arteries supplying your legs. It's the same disease, just in a different location. When you walk, your leg muscles suddenly demand far more oxygen, but the narrowed, plaque-filled arteries simply cannot deliver enough blood to meet that demand. So your muscles cry out, and you feel the pain. You stop walking, the demand for oxygen drops back down, and the pain quietly fades away. That predictable cycle is the fingerprint of the disease. Here's something I want you to really hear. The reason this sign is so dangerous is precisely because it's so easy to explain away. We are all conditioned to expect aches and pains as we get older. So when the legs start to hurt, we adjust. We walk a little less. We sit a little more. We rest when it cramps, and we tell ourselves that's just life now. And in doing that, we quietly hand the disease all the time it needs to keep progressing, completely unchallenged. But here is why this matters far, far beyond your legs. A study published in the Journal of Circulation found something remarkable. Among patients who had peripheral artery disease, 60% of them also had significant coronary artery blockages, confirmed on direct imaging. And here's the chilling part. Most of those patients had never experienced a single episode of chest pain. Not one. The disease in their legs was the loud signal. The disease in their heart was completely silent. And that makes perfect sense when you understand your body. The arteries in your legs and the arteries in your heart are not separate systems. They are part of the same interconnected network of blood vessels. Plaque in one location almost always means plaque is forming in others. So in a very real sense, your legs are showing you what your heart may be hiding. Now here is the good news, and it's genuinely good news. There is a test your doctor can run in about 15 minutes, at little to no cost, with no needles and no discomfort, that can confirm or rule out peripheral artery disease almost immediately. It is called the Ankle-Brachial Index, or ABI for short, and all it does is compare the blood pressure measured at your ankle to the blood pressure measured at your arm using a standard blood pressure cuff. That's it. Simple, painless, and incredibly revealing. Let me tell you what the numbers mean so you understand your own results. In a healthy person, the pressure in the ankle and the pressure in the arm are roughly equal, giving you a ratio of 1.0 or above. A ratio below 0.9 indicates peripheral artery disease, a ratio below 0.7 points to moderate disease, and a ratio below 0.4 signals severe disease, a level that indicates seriously poor blood supply to the limb. Those simple numbers tell a powerful story, and here is what makes the ABI so remarkable. Its predictive power. Research has consistently shown that a low ABI is associated with a 2 to 6 times higher risk of cardiovascular death, even after accounting for every other known risk factor. Read that again in your mind. The pressure in your ankle can predict your future heart attack risk better than most of the routine blood tests we rely on. It's an extraordinary tool that far too few people ever ask about. So write this one down. The letters are A, B, I. Ankle-Brachial Index. If your legs ache when you walk, or if you've ever been told that your circulation is poor, ask your doctor specifically for this test at your next appointment. It takes about 15 minutes, and it just might be the most important 15 minutes you spend on your health all year. Now we come to sign number 3, and this is the one I want you to pay the most attention to of all. It affects both men and women. It is backed by some of the strongest cardiovascular research in existence, 12 major studies covering nearly 37,000 patients. And yet, it is almost never discussed in the context of heart disease. Most people who experience this sign have absolutely no idea that their arteries are involved at all. So let's change that right now. This one requires an honest, open, and direct conversation, because the connection between sexual function and arterial health is one of the most robustly documented findings in all of modern cardiology, and yet almost nobody is willing to talk about it openly. So I will, because your life is more important than any embarrassment. For men, the sign is erectile dysfunction, difficulty achieving or maintaining an erection, and this is especially significant if it developed gradually over time with no obvious cause. For women, the equivalent sign is significantly reduced genital sensation, decreased arousal, or unexplained reduced natural lubrication. And here's the tragedy. These changes in women are too often attributed purely to hormones, or simply waved away as a normal part of aging, without anyone ever stopping to investigate the vascular system underneath. But in both men and women, the underlying cause may be exactly the same. Arteries that are quietly narrowing due to plaque buildup. The same plaque we've been talking about this entire time. Let me explain the anatomy, because this is what makes this sign such a powerful early warning system. The arteries that supply blood flow for sexual function in both men and women are among the very smallest arterial vessels in the entire human body. They measure just 1 to 2 millimeters in diameter. Now compare that to your coronary arteries, the vessels feeding your heart. Those are 3 to 4 millimeters across. Here's why that difference matters so much. When plaque builds up inside the artery walls, the very same amount of plaque creates a far greater percentage of narrowing inside a small vessel than it does inside a larger one. And that means these tiny vessels get affected first. Often 2 to 3 full years before that same plaque begins causing any noticeable problems in your larger coronary arteries. Let that sink in. Your body may be giving you a warning 2 to 3 years in advance, in a way that's easy to dismiss but devastating to ignore. So understand this. Your sexual function is not merely a quality of life issue. It is quietly functioning as an early warning system for your heart, a canary in the coal mine, alerting you while there is still plenty of time to act. And the research is striking. A meta-analysis of 12 studies covering 37,000 men found that erectile dysfunction independently predicted cardiovascular events, cardiovascular death, and all-cause mortality, regardless of every other risk factor. On top of that, research from the Mayo Clinic found that erectile dysfunction preceded a cardiac event by an average of 2 to 3 years. That is a warning window most men never realise they've been given. And for women, please don't think this leaves you out. Studies have shown that women with cardiovascular risk factors who notice significant, unexplained changes in their sexual response have higher rates of subclinical atherosclerosis. That means plaque that is already present and already building, but has not yet caused any other symptom you could feel. So the message is exactly the same for both men and women. These changes are not simply about aging, they are vascular signals. A man experiencing erectile dysfunction after the age of 40 should not simply be handed a prescription and sent home. He should receive a proper cardiovascular risk evaluation. And a woman over 60 experiencing unexplained changes in her sexual response should absolutely consider whether her arteries are part of that conversation and bring it up directly. So if any of this applies to you, please speak to your doctor, honestly and directly. Ask for a full cardiovascular risk panel. That means your cholesterol, your blood pressure, your fasting blood sugar, and if it's appropriate, a coronary calcium score. That last one is a 10-minute low-radiation CT scan that directly measures the amount of calcified plaque sitting in your heart arteries and gives you a concrete numbered risk level you can actually act on. Now let me bring all three of these signs together, because the pattern is what truly matters here. Sign 1 is a diagonal earlobe crease. Check your earlobes today. If it's there, and especially if it's there alongside any other risk factor, ask your doctor for a cardiovascular risk assessment. Sign 2 is leg pain or cramping when you walk that disappears at rest. If that's you, ask your doctor specifically for an Ankle-Brachial Index test. Write it down so you don't forget. A, B, I. And sign 3 is unexplained changes in sexual function, in either men or women. Don't be embarrassed by it. Treat it as a vascular signal. Ask for a full cardiovascular panel and discuss whether a coronary calcium score is right for you. And here is the most important thing I can tell you. If any of these apply to you, especially when combined with high blood pressure, high cholesterol, diabetes, a smoking history, or a family history of heart disease, please do not wait. The window for effective prevention is open right now, today, while you're listening to me. Statins, blood pressure control, a Mediterranean-style diet, regular exercise, and quitting smoking are all proven evidence-based tools that can slow plaque from progressing and can even stabilize dangerous vulnerable plaques before they ever rupture. Remember this, chest pain is a late signal. It often arrives only when the damage is already done. But these three signs, the earlobe, the legs, and changes in sexual function, these are early signals. And early action changes outcomes. It really does. So act today. Now, if this video gave you information that could protect someone you love, please share it right now, before you forget. Send it to a spouse, a parent, a friend. One simple share could quite literally save a life. I mean that. And make sure you subscribe and hit that notification bell, because in my very next video, I am going to reveal the one blood test that most doctors almost never order. A test that directly measures how inflamed your arteries are right now. If you have any of the three signs I described today, this is something you will not want to miss. And finally, I read every single comment on these videos, so drop yours below and let me know. Which of these three signs surprised you the most? Have you noticed any of them in yourself or in someone you care about? I want to hear from you. Until next time, protect your arteries, because every single day they are working hard to protect your life.